Assalamu alaikum, your brothers and sisters. We're very honored to have you all with us. We'll just give it a couple of minutes for more people to be able to join because, we're an international movement with members from all over the world, and there's different time zones that we need to, be mindful of. So, yeah, alhamdulillah, shukrullah. So a couple of minutes, dear brothers and sisters. Feel free to change your names in the Zoom, by the way. Add which country you're from. It's always good to see the diversity of our organization and movement, all those who are seekers of knowledge and who loves to learn more about Islamic psychology. So feel free to change your names, and we will start in 2 minutes, inshallah. Most welcome. All right. Allow me to share my screen. So Sister Ruqaya and Sister Aya, if you guys can admit all those who are in the waiting room, I would really appreciate it. Jazakallah khair for your service. All right. I hope everybody is hearing me loud and clear, inshallah. So let's start. All right, Bismillah, walhamdulillah, wa salawat wa salam ala Rasulullah wa alihi wa sahbihi wa min wala. Assalamu alaikum wa rahmatullahi wa barakatuh, dear excellent brothers and sisters, mental health professionals, Islamic psychologists, students of knowledge, seekers of knowledge, mothers, fathers, brothers, sisters, members of the ummah, Muslimah. There are so many titles that we can use to address each other, but we're all, in the end, we're all just vicegerents of all on earth to live upon the will of Allah and to follow the footsteps of our beloved Prophet sallallahu alaihi wasallam. It's such an honor to be with all of you. We've been having a summer break for 2 months, so we're very excited to reestablish the international lecture series that ISIP is organizing twice a month. So this is our first session for this fall and winter, inshallah, and we're so honored to have you all with us. Feel free to change your Zoom names, add which country you come from. It's always beautiful to see the diversity that ISIP represents. Feel free to use the Zoom chat as well to introduce yourself and to connect with one another. Throughout the session, we will share some valuable resources in the Zoom chat from me and my colleagues, YouTube channels of ISIP, our WhatsApp groups for discussions and resource sharing, and many other beneficial resources as well. We've been really missing you all. We've been missing connecting with you all. I hope you all have had a great summer. I know that it's not summer all over the world. In Australia and South America, it's actually not summer right now. And I also think, if I'm not mistaken, it's not summer in the southern parts of Africa either. But so happy winter for all of you, or whatever. Some countries never have any other season than one season, by the way. I was just recently in Malaysia, where they always have one season. Also in Colombia, where I was visiting, they always have one season. So nevertheless, happy summer, happy winter, happy fall, whatever season you're in. I hope you had a great vacation if you had a vacation. If not, I hope you had a great work or whatever your guys are occupied with. We're very honored to have you with us. So we will do a brief presentation of today's lecture and lecturer, and also briefly a bit presentation about ISIP. So today's lecture will be about counseling from an Islamic perspective, together with Ustad Stephen Abdullah Maynard from the UK. We're very honored to have him with us. He is actually one of our supervisors in the Islamic psychology supervision that we have, and which we offer to people that are trained in mainstream psychology and do want to apply Islamic psychology in their clinical practice as well. An honor to have you with us, Ustad. Bismillah ar-Rahman ar-Rahim. So today's agenda, dear brothers and sisters, we start by reciting Surah Al-Fatiha. Then we go through some welcoming guidelines. We will give a certificate of appreciation to our Ustad as well. Then we will listen to a lecture by our Ustad, which will be for about 50 minutes. And after that, we will have Q&As, and then we will close up, inshallah. All the questions, you guys can add them to the Zoom chat, and we will address them to Ustad Abdullah in the end of the session, inshallah. So ISIP, we always adhere to these Zoom etiquette. So have your microphone muted at all times. This is for the quality of our sessions, dear brothers and sisters. We would really appreciate it. No recordings or screenshots are allowed. We will share the recording of the lecture within a couple of days on ISIP's YouTube channel, and you will find our YouTube channel link in the Zoom chat that we will share throughout the session. If you have any questions, as I referred to earlier, feel free to add them to the chat, and we will address them to Ustad Abdullah in the end of the session at the Q&As. If you need any live transcriptions, feel free to press the More button in the end of the Zoom application in the bottom end, and then you can request and get access to it, inshallah. A little bit about ISIP's mission statement. So ISIP, the International Students of Islamic Psychology, is an inclusive space designed to connect people with from diverse backgrounds who are interested in Islamic psychology and Muslim mental health. So whether you're, which nationality you have, which, where you live geographically, which educational background you have, it doesn't matter. As long as you're interested, this movement and organization is for you, our excellent brothers and sisters and members. We aim to disseminate knowledge, share resources, and discuss best practices in a free and accessible manner. So everything that ISIP does is free of charge, because we want all brothers and sisters, all people, no matter which social, economical background you have, to benefit from the sacred knowledge of Islamic psychology. ISIP also aspires to be a platform to enable further development of people's personal and professional interests, studies, and understanding of Islamic psychology within their communities and countries of origin. And ways that you could continue to participate and be part of ISIP, feel free to subscribe to our YouTube channel. The link will be shared in the Zoom chat. You can join our Islamic Psychology WhatsApp groups for resource sharing and discussions. We will also share those links in the Zoom chat. And you can also become a member of ISIP via our website at www.isip.foundation. And also the membership is free of charge, dear brothers and sisters. And then you can get access to our digital library, for example, with over 1,000 resources connected to Islamic psychology and Muslim mental health. If you want to join our local and regional chapters, we have local and regional chapters all over the world. Feel free to reach out to us. We will write our email address. You guys can also write to me personally on WhatsApp as well. And we will be more than happy to add you to the different teams. If you have an idea of developing new projects, new initiatives, and new task forces as well, or new local and regional chapters that doesn't exist, feel free to reach out to us as well. We will give all the details in the Zoom chat throughout the session, inshallah. Now, dear brothers and sisters, let's go to the main person and the main reason why we all are here in this session today. Allow me to introduce Ustad Abdullah Maynard. He is a psychologist. He has a bachelor's in psychology from Surrey University, a master's in social policy from Middlesex University in the UK, and a diploma in humanistic counselling. He's the founder and partner of Stephen Maynard and Associates. He is also the founding member of the Lateef Project, which offers Islamic counselling as part of the mainstream services for the National Health Services, NHS, in Birmingham. Abdullah Maynard, along with Sabnum Daramsi, developed Islamic counseling in 1996, subhanAllah. So Ustad Abdullah is one of the pioneers in the field. One of the first Islamic psychology therapeutic models. In 1998, his paper, Islamic Counselling, was the first paper on Islamic counseling published in English. He has developed related training since 1996 to 2001. And yeah, there's so much more we can say. In 2008, Ustad Abdullah Maynard wrote the Department of Health Muslim Mental Health Scoping Report for the UK government. Ustad Abdullah is a revert and has written several papers on Islamic counseling and Muslim mental health, including papers on the efficacy, the effect or impact of Islamic counseling and working with refugees. So before you start, Ustad Abdullah, this is just really a recognition from all of us from ISIP, from my colleagues, Sister Aya, Sister Ruqaya, myself, Sister Fatima, who's also one of the co-founders of the organization, a certificate of appreciation for your times and efforts and in recognition of your continuing excellence in the field of Islamic psychology. And this will be sent to you as well. And by the way, dear brothers and sisters, we will send some forms in the Zoom chat for you to give your feedback with regards to our, lecture series. If you have any inputs, if you have any suggestions of other, lecturers that we can invite to our lecture series, feel free to give us feedback. Your feedback is very valuable for us. So allow me to stop sharing my screen. And without any further ado, let me just highlight Ustad here, replace pin. So without any further ado, the floor is yours. Feel free to start, Ustad Abdullah, and honored to have you with us. Bismillah.
Bismillahirrahmanirrahim. I'm just trying to share my screen, but as I do that, I would just like to thank ISIP for inviting me to speak and thank the team for all the work that they have done in establishing this platform and allowing me to be here as one of the presenters in your autumn program. I'm not sure that my presentation has come up as yet properly. Is everyone able to see this?
Yes, we're seeing it, Ustad. Feel free to go on. MashaAllah, it looks great.
Okay. Bismillahirrahmanirrahim. Counseling from an Islamic perspective. The first thing that I would really like to do is to explain that the purpose of this work is not only the systemic improvement of Muslim mental health, but primarily the embodiment of the psychospiritual reality of Islam in the current lived reality or realities through psychotherapeutic work in such a way as to facilitate psychospiritual growth and well-being. And in saying this and in committing this to this, I ask Allah to cover my faults. Now, the simplest way to describe what we know of as Islamic counseling or counseling from an Islamic perspective is to think of Islamic counseling as worship through the service of the self and the ruh before you when that self is in psychological distress. Now, I'm going to ask you to excuse me, forgive me. I wrote a paper. It was incredibly complicated and long. There is a lot that I'm trying to get through in this talk, and I'm not sure if it will be all done within 50 minutes, but I will try and make sense, as in not rattle through it too quickly. And I'll also try and, inshallah, keep to the brief and get it all across. But in doing that, what I hope to do today is to share with you the evidence of Islamic counseling as a therapeutic intervention of our time. I would like to give you a little bit on the historic context of the work and some of the key aspects of Islamic counseling. And with that, what I'd like to do is also get across that what this means in terms of the embodied nature of Islamic counseling. I'd like to then briefly talk to the context of the work and bring this all back to what I was saying a moment ago about its systemic and psychospiritual relevance. Okay, first what I'm going to do is talk to evidence. And in order to do that, what I'm going to do is share with you some results from qualitative and quantitative studies, two of which are published and two are waiting for publication. I'm going to start with the qualitative work, which focuses on the therapeutic relationship. And I hope that what this will share is some of the significance of this work in terms of the therapeutic relationship as a space wherein there is a potentiality for psychospiritual growth. Now, this work was done in 2021. It was carried out by a master's student at Westminster University. It had a group of 9 of our clients who had completed therapeutic work, and they were individually interviewed in semi-structured interviews that lasted for between 15 and 60 minutes. 7 were female, 2 were men. But one of the things that I want to get across is that the qualitative research gave these participants an opportunity to express the significance of working within an Islamic framework. As you can see, here are some of their responses. So, for example, for most Muslims, their faith is a huge part of who they are, a part of their identity, and how they frame everything that they do in this life. Or another participant said that that's my identity, like that's who I am, you know, Islam is part of me. The third said, I really loved, I guess it's like an Islamic thread running through everything. And for me, it's such a huge, the biggest part of my life. So one of the things that I want to get across is clients, people who come to our service, see their reality, see themselves, see their experience in the context of Islam, which is something that we know, but not necessarily shared by most mental health professionals across other contexts or models. Moving on. This therefore allowed clients to express the preciousness of their faith. And this particular quote I find quite important in the context of where and when we're doing this work, because we're obviously working in the United Kingdom in the beginning of the 21st century. So as the participant says, I know that I would have felt incredibly judged by mainstream services. It was always like, I love my religion, but I know especially in this country, especially in the last 20 odd years, Islam has got a lot of bad publicity, a lot associated with violence and some sort of patriarchy and, you know, like horrible, horrible treatment of women. I didn't want to be responsible for strengthening that association with Islam. To be honest, I felt very protective of it. Now, for me, one of the things that this indicates is the way in which not only do clients self-censor when they're talking to therapists who are not Muslim, but also the way in which we don't expect, we literally don't expect to be able to bring our whole selves to a therapeutic space. The therapeutic process helped clients to separate Islam from culture. Now, this is important in terms of actually looking at this stuff around the spirituality, the meaning of their deen in their lives for the clients. It was just so nice to be reminded, well, actually, they're not always Islamic expectations, but cultural, which I guess I'd forgotten, or in some cases, wasn't even aware of. I haven't really talked a lot about spirituality, the spiritual side of my life and those sorts of things. So that's probably why I haven't picked it up as much. You know, the sort of spiritual benefit that you can get from Islamic counselling. To me, this speaks directly to the fact that these were clients who were enabled to have a therapeutic space where their truth, their relationship with their deen was central to their process of change. Okay, yes, the sample was predominantly women, but it's important to actually recognize the significance of Islamic counselling in regards to working with women. I think this is especially important for women who are going through like a hard time and they just continue. I think it will liberate a lot of women being able to talk about it and come to your own thoughts from having those conversations is really important. Clients found benefit in the therapeutic reflecting on reflecting on their lived experience. So their experience of life, whatever's going on with them, and their spirituality, the two linked in a therapeutic space. I'm definitely feeling a lot more positive, yeah, a lot happier, and I kind of accept things more, and I feel I'm in a better position in my relationships. I'm not going to say this lightly, but honestly, it changed my life for me. It's completely like changed how I see, how I look at everything, and it's just was such a nice environment to be in. Okay. I want to move on. So that was qualitative research done with a small group of people looking at the therapeutic relationship. That piece of work was carried out in 2021. It's not published. There are other pieces of research that we have done. The long-term quantitative research has been carried out independently. It is published in peer-reviewed, one paper in a peer-reviewed journal, the other in a peer-reviewed book. Okay, so we carried out a piece of work in 2011, which was a 1 year prior, 1 year post analysis. And so that's 1 year before someone actually starts their Islamic counselling and a year afterwards. Looking at people who were experiencing not just a common mental health problem like anxiety or depression, but that it was people who were having that concomitant with, comorbid with, a long-term condition, physical health condition, such as, say, I don't know, heart disease, diabetes, those sorts of things. And we wanted to see whether or not Islamic counselling had any impact on their use of health service facilities, both their doctors in the community and their use of hospital services. Now, this and all of the quantitative evidence that I'm going to share with you was analysed and was statistically significant. So here we found, with this sample, an 82% reduction in patient use of hospitals across outpatient and inpatient facilities after Islamic counselling. And that included a 52% reduction in their use of emergency services. When we looked at that same group of our clients or NHS patients, what we saw was 3 years after, there was a 43% reduction in hospital use and a 56% reduction in related costs. Okay, now you could think about this as a fairly indirect way of looking at the efficacy, at the impact of Islamic counselling, because there are a number of factors here. It's not just anxiety or depression. It's working with clients who had maybe both or one or maybe the other. And it's also comorbid with another condition. But the reason we actually did this work was because these are common presentations in our context. This is what people walk into our service with in terms of saying, I need help. So that's why we focused that. But it didn't change the fact that there was actually still a need for a much clearer, much simpler piece of research. So actually, at the beginning of this year, we finished a study with 52 clients. And this was a much more immediate study. We were assessing people using standard assessment tools used within the health service, GAD-7s in regards to anxiety, PHQ-9s in relation to depression. And okay, so it was immediately before the person had Islamic counselling and immediately after. The majority of the clients having had both conditions. What we saw was that the vast majority improved in their well-being. There was a drop in terms of a threshold in relation to either of these tests. So this was carried out literally after 6 to 8 sessions. And the results are as follows. After 6 to 8 sessions, 2 of our clients were in remission across both conditions. So they'd gone from a situation in which the test results had shown anxiety and or depression to a situation in which there was none, no sign of either. We had 3 who were in remission in relation to anxiety and 8 who were in remission in regards to depression. 82% of our clients with anxiety experienced a decrease in their symptoms of 1 or more thresholds. So that's an order of magnitude. So for example, from severe to moderate. 67% of our clients experienced a similar drop of the threshold or more in regards to, say, severe to moderately severe or moderately severe to moderate in regards to depression. And 58% of our clients experienced reductions in both conditions of 1 or more thresholds. Now, why this is important is because this is in comparison to the kind of test results that you get from CBT, which in the UK is considered to be the most appropriate therapeutic treatment in most situations regarding common mental health problems. Now, yeah, we're talking about specifically Muslim clients, and we're talking about the presentations, which are often complex within specifically Muslim clients. But what you're seeing here is that our work is outperforming CBT. Moving on, though, I'd like to just talk to you very briefly about the historic context of our work. So, Islamic counselling, the term was first coined in 1994 by Alia Hairi, a transpersonal psychotherapist, following her work with her husband Sheikh Abdullah Hairi on his books The Cosmology of the Self, 1987, and The Journey of the Self, 1989. Sheikh Abdullah Hairi is a Sheikh of the Shadli Tariqa. Her work was originally outlined in a 5-day training course. Two of the participants in that training were Shabnam Ramzi and I, and we're both Murids of Sheikh Abdullah Hairi. We asked for idhan, for permission, to develop this work. With that, within 2 years, there was sufficient work done to actually have a developed therapeutic application. And in 1998 was the first publication in English on Islamic counselling. It was beginning in the beginning, Islamic counselling. It was in the Journal of the British Association of Counselling. 1998 also saw the beginning of the independent training program. These are courses, vocational qualifications, 2 certificate courses, then followed by a diploma. Over 3 years, that program will lead to a professional qualification in Islamic counselling. And with that, the first Islamic counsellors were qualified just after 9/11, and their qualifications and all of those following are recognised in the UK and across Europe. Now, we have actually extended that progression route, and there is now a 4th qualification to complete the route to a trained Islamic psychotherapist. Okay, now it's time to actually talk a bit about Islamic counselling. And in order to do that, I need to root this work within our deen, within Islam. First thing I really want to talk about is the covenant. Allah asked all the arwah, am I not your Lord? And the answer was, of course, yes. And that happened before time. Now, that exchange led to the deen, the life transaction, all that we understand in terms of our relationship with Allah, all that we know of Islam. But more importantly, one would say, it led to a lived existence in time-space, because the deen is the deen because it is what we are using to understand this reality. So with that comes the qadr and qadir, with that comes the decree, the destiny, with that comes entropy, with that comes all of the things which actually make sure that we go through life from birth to death to return to Allah. And with that, much more importantly, is the indebtedness, because we are indebted for being given our existence. We are indebted for our actual life in creation, and that indebtedness then translates into the fundamental purpose of our life, which is the worship of Allah. And with that worship comes the aspect of the covenant, which we know as tarbiyah. And I talk about tarbiyah here in terms of how it is derived from rububiyah. Tarbiyah, rububiyah, Rab, Abd, lordship, slave, a covenant between the divine and us, in which we will be brought to our highest potential in this process of life as we travel from him, by him, to him. Now, if tarbiyah is a universal process for all of humanity, a lifelong process, then what that means is that psychological distress, just like everything else, sits within that context. But let's actually think a little bit about the who in all of this. And I don't want at this point to focus on ruh. I want to focus on this, at this point, on nafs, on the self, on the conscious entity, which is a human being. And I think a simple way of looking at that is that we are a combination of what we think, what we believe, what we feel, what we say, what we do. And that's an embodied combination because we are physical. But it's that consciousness, that interaction between those levels of being that then facilitates our interaction within our own self, our interaction with other selves, our interaction with creation, but primarily our interaction with our Lord. And in that context is niyyah. The thing that we know is what we're judged on, our niyyah, our intention. Okay, moving on. So a simple way of thinking about this is that the human condition, because it's in transition, because it is developmental on a journey of growth, is perfect imperfection. As I said, from Allah, by Allah, to Allah. Tarbiyah is a learning process for Abd, so that we are able to see Allah behind everything, in everything, and ahead of everything, so that we can truly know in this realm that Allah is our Lord. Okay, so this is the developmental process of tarbiyah. It's the central factor behind our existence. It is in all facets of our existence. It encompasses everything about human experience, of the self, of creation, all of this in relation to the divine, in relation to Allah. Everything we therefore experience is actually psychospiritual. Tarbiyah enables psychospiritual growth. This includes therapeutic change. Let's kind of like think that through. And let's try and put it in a way that makes some sort of sense. So human growth and development originate from the divine covenant. Tarbiyah is the active process of human growth, which incorporates therapeutic change. Being conscious, we are both self-aware and we have choice, niyat, we have intention. This is not to be confused with outcome, because we are not in control of outcome. Choice within the self enables something which I haven't mentioned to you, which is the dynamic that takes place between the self and the soul, the dynamic that takes place between the ruh and the nafs, the dynamic that takes place between that which is timeless and which is the will of your Lord, that of which we know little, and the you, the I, the thing that is in this plane, which has the ability to evolve. Now that's interesting because that ability to evolve is through our intention, and that intention, if it is aligned with the soul, if it is aligned with the role, is our growth. But we have this choice and we exercise it continuously. And in that context, we learn experientially, including through our apparent errors. Growth is enabled by choice within the diversity of apparent reality, only for the purpose of actively, intentionally returning to Allah. Now, if all of that makes sense, and one of the things that's really important to understand is that if Islamic counselling has a therapeutic component, but that therapeutic component is part of tarbiyah, then that basically means that change, therapeutic change, is with Allah, not with the counsellor. Islamic counselling is a therapeutic process of reflection in which the Islamic counsellor works with a client in awareness of both the counsellor and the client's tarbiyah, in a way that is about active service of the client to enable reflection, and with that therapeutic change in the context of their lived reality, whilst being aware of the change occurring within themselves through their own tarbiyah. Now, each and every single one of us was created by Allah for Him, for the worship of Him. And each and every single one of us is given the opportunity to be of service through service to His creation. So an Islamic counselor in Islamic counselling is both in their own tarbiyah and trying to be of service to another human being, another sentient being, another consciousness in their journey to Allah. Here, ease and dis-ease, as are apparent good and evil, they're indicators, ways to help us perfect our intention, to enable us to do the course corrections, to align ourselves with our ruh, and therefore actively seek the worship of Allah. So therapeutic change is by Allah, not by the counselor. The Islamic counselor must work primarily on their state to enable them to be a clear mirror, to facilitate an environment in which the client can be in a state of fikr, a state of reflection. Islamic counselling is an embodied state in which the Islamic counselor is in trust of Allah and hence ready to engage with the tarbiyah of both the client and the counselor. I'm going to talk more about this matter of embodiment. What I want to try and get across here is that despite the fact that Islamic counselling has a wealth of theory, it has maps of the self which depict what is balance, what is imbalance. It has a process, it has a skill set, it has protocols in relation to anxiety, depression, PTSD. Despite all of the things that an Islamic counselor learns to do, the most salient, the primary, the most significant thing within all of this is the way that the Islamic counselor learns to be in a state of presence when they're actually working with a client. And it's that state, it's that being, it's that which is core, because effectively the therapeutic relationship is a relationship that is heart to heart. Now, within many of the teachings of tasawwuf, and I will freely say that the theory of Islamic counselling is based on core sources, Quran, Sunnah, and also the science of tasawwuf. Within many of the schools of tasawwuf, there is the understanding that the heart, which is also obviously within the Quran, is higher than the aql. However, we quite often get into a situation in which we think rather than experience the reality from the heart. And note when I say experience the reality, it appears to be a much less active process. But that's only because that process is much more about being and much less about doing. So there is a way in which an Islamic counselor, when they are working, they are before Allah, if they're working Islamically, and they are present, and they are present providing a therapeutic space for their client, who is also invited to be present. Now, that invite is important partly because not everybody actually wants to work at a spiritual level. Many people will come to Islamic counselling in a way in which what they're really trying to do is just deal with the symptomatology of the dis-ease that they are experiencing. So they're trying to find an outer balance, and that's perfectly acceptable, considering the simple fact that if you're on a horse and you want to talk to somebody on the ground, get off your horse. So we meet the client where the client is, in their reality, in their conceptions of their deen, their Islam, in their conceptions of their experience, in their conceptions of their self. But to do that, it requires that we are in a state in which we, as Islamic counselors, are before Allah. We've stilled our hearts and removed the other agendas. For Islamic counselling to be a therapeutic process, to function, it requires hudur. It requires humility before Allah. It requires openness to the will of Allah. Because we need to be open to the process of tarbiyah, the process that is ongoing for client and ongoing for self. And I say we need to be open to that process simply because, just speaking for myself, there are points in my life in which I am, and points in my life in which I'm not. I'm not necessarily open to the process of tarbiyah when I'm stuck in a traffic jam and I'm late for an appointment. My conscious mind and my niyat, my awareness may well perceive my reality in a very, very two-dimensional, pragmatic way. But we have the gift of being able to not just be in a flat, two-dimensional world, but to be connected, to be in a world in which we actually see Haqq. And that's why this is about heart. That's why this is about presence. That's why this is about seeking to follow the will of Allah, having a heart that is clear of other agendas. But I will honestly say that does not necessarily mean that all Islamic counselors at every point when they're doing Islamic counseling, or every point when they're doing counseling, have that stillness of heart to be doing Islamic counseling. This is quite ironic because as Islamic counselors, niyat can change, awareness can change, we can become distracted. But then that also means that part of the awareness of the Islamic counselor has to be an awareness of their own state so that they can see the situations that are happening within the therapeutic relationship that are triggering them in terms of their inability to maintain the stillness of heart, so that they can then take that material to their supervision, to their personal counseling, so that they can then do that internal work in regards to their tarbiyah. I say that because what I'm trying to get across is this next point, that it requires compassion. It requires compassion for the self that is before us. And let's face it, there are a variety of reasons why people come to counselling. People come to counselling either because they are experiencing something like, I don't know, pain, anxiety, depression, or another set of symptoms which we have identified as a psychiatric or psychological imbalance, or because they feel stuck and they have a problem that they aren't able to actually address, or because they are seeing that even in terms of their development, in terms of their growth, things are not as they wish it to be. But whatever the reason is, our clients are trying to come to a new level of balance. And the imbalance that's brought them to counseling, it may be internal, it may be external, but whatever it is, its purpose isn't anything but their tarbiyah, because absolutely everything in our life is again about our tarbiyah. And it is important that the Islamic counsellor is able to be aware of that and with humility have compassion in relation to their clients in that context. And all of these things, really, if you think about it, mean that there is a kind of submission in Islamic counselling. I'm not saying that an Islamic counselling is inactive, and I'm not saying that an Islamic counsellor simply agrees with everything that the client says. I'm not saying those things at all. What I am saying is that submission is to the will of Allah. And what I am saying is that that openness to His will is in the context of the confusion, the murk, the pain of witnessing the reality of the client and trying to hold the space open for them to actually work through to something which is in better balance. Now, all of that being said, it's important to talk about the context of Islamic counselling. Now, I'm going to talk about this first from the kind of like macro and come down to the micro. And what I want to do is in a way talk from the position of a disclaimer, because everything that I'm talking about, the evidence of the fact that it has impact, the relationship it has with Islam, the way that the Islamic counsellor is, the embodiness of this process, all of that is actually situational or context specific. And the reason I say that is because this work has developed at this time in the context of the Northern Hemisphere in the UK. And that's important if we recognize the fact that this time is not as it was, say, a century or 4 centuries ago. It's important if we recognize some of the imbalances that are current in this time, the large-scale imbalances that impact on the intrapersonal, interpersonal well-being and relationships of our clients. We're working in the UK, which is a country experiencing late modernity, and I talk about late modernity rather than post or modernity simply because we in the UK have a very diverse population with lots of people from lots of countries who have been in dependent, colonialized relationships with the host community here. And in that, I'm trying to identify the fact that our community of Muslims in the UK experience racism, experience Islamophobia, And these are subtle but large-scale processes in their lives, which are out of their hands, but can be in certain contexts definitive. And I say that because what I'm trying to get across is that actually, though a lot of the work that is done in many contexts around counselling specifically thinks about the intrapersonal and the interpersonal, thinks about the client in terms of what's going on within themselves, and the client in terms of what's going on in their immediate relationships or the historic relationships. Within Islamic counselling, we have to take into consideration that a Muslim's well-being in the United Kingdom can be defined by situations which they have no control of, because these are situations which are not just interpersonal. When, for example, we're working with refugees, we're working with people who are experiencing geopolitical realities which are shaping their lives and shaping who they are being. So it's important to understand that at the macro, we're dealing with not just the person, their family, their community, and by that I'm talking about their community within the Muslim community, their society, their geopolitical, their economic position. Because all of those things impact differently on us. And I say us, talking about the fact that Muslims actually account for 23% of the global population. And in that, the thing that we share is our faith. But in every other aspect, we're super diverse. And so knowing that and knowing the context, I have to say that I know that this work has been effective in the United Kingdom. I can't say with certainty that this work is effective in, say, a country which has got a Muslim majority, or a country in which there isn't racism. And I mention racism because the vast majority of Muslims in the United Kingdom are not white. And a country which does not experience Islamophobia. I am acknowledging that those wider factors are there in addition to the stuff that we individually create in terms of our interactions at that level of consciousness, that beingness, that sayingness, that doingness. Sorry, the things that we think, the things that we feel, the things that we believe, the things that we say, the things that we do. I mentioned these earlier on, and it's important to understand how significant these things are, because actually human beings find it difficult to get synergy, to have moments of agreement between these factors. All I need to do is think of the last time I acted in relation to a belief rather than in relation to what I knew, and I can see within myself that, yeah, there is a stress, there are strains within just being this sentient human. We are not, irrespective of the fact that that's quite a strong discourse that argues this, we're not that rational. And in a way, if we understand what we are as Muslims, if it's about heart, then that's about something greater than rationality. So irrespective of all of the big stuff in terms of geopolitics, etc., and all of the external factors, there's still this thing about what is happening in me, what is happening in my client intrapersonally, and in their relationships between them and others, who are also a combination of those same factors, which creates dis-ease. Okay, that stuff we work with, that stuff we work with in the UK, and I am assuming that that stuff is being worked with across the globe. And that stuff, I believe this process can work well with. But as I said, I don't know about, I can't say that this is the way or a way globally, because I don't know. I have to be honest with what I know. Understanding the context, though, in terms not of the macro, but of the micro, that stuff around what we think, what we feel, what we believe, what we say, what we do, our intentionality, and how that relates to our interactions within ourselves, our interactions with each other, our interactions which we experience intergenerationally. This is the crux of so much therapeutic work. And this is the space in which our clients bring themselves, bring their experiences of reality, bring the who they are being, as well as the what they are doing. And this is what we work with. And we do that work without trying to make assessments which are historic or assessments which are based on personal agendas. Because at the end of the day, what we're trying to do as Islamic counselors is work with the tarbiyah of that client as it is in their relationship with Allah, rather than foist upon that individual our own understandings of this relationship. As I mentioned, 23% of the global community cannot help but be super diverse. My understanding of my relationship with my Lord constitutes my path, my journey from Allah, by Allah, to Allah. And if I need therapeutic support, I need therapeutic support as I try and grapple with my apparent realities in the context of my experience of that journey, in the context of my tarbiyah. And this is how we see the lived realities of our clients. And in seeing the lived realities of our clients in that way, what we try and do is see the things that have brought them to therapy in that context for what they are. We have clients who have come for a wide variety of complex reasons. Things which are very, very, very painful. Everything from war-related trauma to female genital mutilation and the gamut in between. And what we try and do is work with their experience and their truth. And what we try and do is work with their truth because their truth relates to Haqq. And their journey is what is bringing them back to Haqq. And actually it's in this context that I would like to suggest to you that the work that we are doing has a psycho-spiritual relevance, not because it's trying to shape or reform, but because it's trying to enable people to, through reflection, through fikr, if they wish, see the haqq in their lives and in their situations, that is, before the situation, in the situation, and after the situation. And if they choose to do that, we are working with them in a way in which they may then start to align their intention with their ruh, align their intention with the divine. So that tarbiyah isn't something that's just unfolding for them, but it's something that they are actively engaging in. And this is what we're trying to do for ourselves. And that's part of the reason why I said earlier on, it's an embodied process. So we see this we see this as certainly a spiritual, a psycho-spiritual reality of what Islamic counselling is about. I've said that it's also systemically relevant, and that's because if we go back to the data that I showed you at the beginning, we are talking about a therapeutic method which works with PTSD, various different forms of neurosis, anxiety, depression, addictions, phobias, suicidal ideation. And it works in a way that is addressing not only the psychological, the kind of clinical diagnosis, not only the problem, but it is supporting the client in relation to their underlying concern, which so often is, how do I deal with this in the context of being Muslim? And how do I deal with this in the context of what that means in this society and in this community? So we're doing some work which is, it's having impact, and I can't say that we're doing this at a phenomenal scale, because all of this work is under-resourced, and actually I'm proud of the fact that we have evidence, because even if you think about it, there's never ever been funding to actually do the research on this. But this is evidence, this is proof of the fact that Islamic counselling as a therapeutic process literally outperforms CBT. Now, for me, if Islamic counselling, if Islamic psychology, if all of the work that we're about in terms of Muslim mental health has relevance, it has relevance in the fact that we are able to address the spiritual, the psycho-spiritual reality of the client in the light of Haqq. It has relevance in the fact that we are able to address their condition, their mental health problem, and at least alleviate some of the symptomatology. I would like to suggest to you that this is being fulfilled through the work of Islamic counselling. The research I've talked to you about was carried out within the Lateef Project. You'll have noticed it's mentioned at the bottom of the page. Now, that's an agency that's been providing Islamic counselling since 2010 in Birmingham, in London, through the pandemic, in regards to people in the community, in regards to refugee communities. So we know from over 10 years of experience some of the complex presentations within the community and the fact that they can be addressed. The other name that you see at the bottom of the page is Stephen Maynard and Associates, and that's the organization that does our training. And if anyone has interest, we'll be running our level 2 program very, very shortly. And that program can be engaged with via the internet. So I thank you for your attention, and Assalamu alaikum.
Assalamu alaikum, dear Ustad Stephen. Jazakallah khairan for an amazing lecture. Round of applause. If you could just stop sharing your screen so we can have both of us. So we will. Barakallahu feekum. Thank you so much, Ustad Abdullah. Round of applause to our beloved Ustad here for an amazing lecture. Many gems, many insights, both for mental health professionals, but also for people that are just interested in the field of Islamic counseling and Islamic psychology as well. So dear brothers and sisters, feel free to give some digital applause. And yeah, thank you so much. We have a couple of questions, Ustad Abdullah. Sister Rabi, if you can write your question in the chat as well, I would really appreciate it, because we tend to just take all the questions in the chat due to time restriction. Sister Jamila is asking, what are your experiences concerning child psychotherapy?
That's a lovely question. I'm trying to remember which year. We were engaged in the national program in the UK from 2014 to 2018, IAPT, Increasing Access to Psychological Therapy, and that was the adult program. But if I remember rightly, 2016, 2017, we also, as part, and I'm talking about the Lateef Project, we also, as part of a wider partnership of voluntary sector organizations, became engaged in the children's IAPT provision. So that's the national program working with child psychotherapy and counseling children. So we've been part of that program for a few years. But in addition to that, our service generally is provided for anyone from the age of 11 up. So we have Islamic counselors who specialize specifically in working with children and young people. We haven't as yet done the additional work to develop the model below the age of about 10. But there's only so much you can do in a working day when you're trying to juggle all the plates all at the same time. But yeah, we've been working for quite a while consistently with children and young people.
Thank you so much for sharing. Just to add to what Ustad Abdullah said, there is actually this aspect of the field of Islamic psychology is still a lot of things needs to be done. So we will recommend to all of you participants are interested in research or curriculum development to really join our Tarbiyah task force as ISIP, because there we're going to focus on both collecting resources and programs like the ones that Ustad Abdullah is organizing and others as well, and also to develop initiatives and programs within the ISIP as well. So we will share the link to the Tarbiyah task force for you to join. And this is one of the parts of the Islamic psychology field that is not yet a lot of development yet. And so your inputs, dear brothers and sisters, will be very beneficial, inshallah. Also, to all of you asking for Ustad Abdullah's resources, article, courses, programs, register yourself. I just shared the registration to this lecture. We will share all the articles, all the links, all the contact details for the courses from Ustad Abdullah. So you will give it to us, Ustad Abdullah. We will share it with all of those who register to this lecture. We will also add your organization in ISIP's website as one of those who are providers of programs, courses, and educational initiatives in the field of Islamic psychology. If you go to our website, and Sister Ruqayya, please share our website's directory link to all of the educational initiatives. We have a directory link, dear brothers and sisters, where you can see all the institutions, all the organizations, all the colleges and universities that are offering programs or courses in Islamic psychology. We will add also Ustad Abdullah's organization to that. We don't have your organization there, so we will add it there. And all the details we will share in the email. So register yourself to the link. Barakallah feekum. So Sister Ruqayya, it's not the website. If you can share the website and specifically the tab with the directories, if you can find it, I would really appreciate it, Sister. Jazakallah khairan. You're doing an amazing job. There is a question from Sister Samar. Good question about child psychology, because as mentioned, the goal with adults is to develop tafakkur. A child who is not accountable or at a stage with a developed aql, intellect, what would the therapeutic goal be for children from an Islamic psychology perspective? Would you like to answer that question, Ustad Abdullah?
Well, it's interesting because I'm not going to try and answer it from an Islamic psychology perspective. I can only answer it from the perspective of Islamic counselling and the theory that we have. So I'm not
Okay.
going to try on board other work. Even in terms of talking about Islamic counselling, there are other theories other than the ones that we've been discussing today. But if you were here at the beginning of the talk, then you'll know that I was talking about the relationship between ease and dis-ease. Now, interestingly, we find that a significant proportion of the children and young people that we are working with or have worked with are experiencing a variety of forms of dis-ease. And I'm not saying disease, I'm saying dis-ease. And that can be in relation to historical current trauma, that can be in relation to acting out situations that are taking place within family systems. So one of the things that we find a lot of the work that we're doing with children is to try and support them in relation to that emotional imbalance that they are experiencing as they try to grapple with it within the context of, whatever level of akal, whatever level of intellect they have. Does that make sense?
Yeah, sure.
Okay. Because realistically, particularly when we're talking about children who are identified within a wider family system, too often what we find is that they're in a way the canary in the coal mine. They're the person who is easily identifiable in relation to something which is systemic within the family system, which they are not the cause of. So it's critical that they are held and supported therapeutically so that they can endure and so that they can grow through processes which are not in their control.
Perfect. Thank you. Very clear and thorough answer. I hope it answered your question, Sister Samar. Just to perhaps add from Islamic psychological point of view, it's a very good question, by the way. What would be the therapeutic goal for children? In many ways, I mean, even though, depending on which age a child is, right? What are we speaking about? But generally, I think all therapeutic goal from Islamic psychology point of view is to reconnect with fitra. So in many ways, it's actually easier to reconnect a child to fitra than an adult to fitra, because children has not been as disconnected to fitra as we as adults in many ways, right? Due to socialization, we get more and more disconnected, So one very important, point of view in the framework of Islamic psychology as a clinician who is applying Islamic psychology is to reconnect, whether you're a child or an adult. And then, of course, we need to be mindful of children's disposition, because children should be allowed to be more, curious in a sense, should be more allowed to, even test things in a way that maybe we as adults do not do. And also, children are in a stage of marination and maturation, which means that, as you also perfectly alluded to, the whole aspect of taklif, children doesn't not adhere children, right? So we need to be mindful of that when we're working with children from an Islamic psychological point of view. Well, with the aspect of fitra, then of course that should be the aim of all Islamic psychological interventions. Allahu Akbar.
If I could just quickly add to that,
Yes, of course.
add to that, taking that point on board and recognizing it in its centrality, because clearly, again, if somebody was at the beginning of this talk, they would know where we stand in regards to what Islamic counselling is about. With children, one of the things that's quite interesting is that there's a way in which children have a resilience which is more flexible than many adults. One of the things that we are trying to do often when we're working with children, when I talk about enduring, is enabling them to enabling them to maintain their integrity so that they do not become further damaged, so that with that resilience, they are able to reconnect to the divine. Because one of the things that we know from psychology as a whole is that a lot of our long-term psychological problems start quite early in life.
Yeah.
And we also know that a lot of those long-term psychological problems, if dealt with at that point, actually can be resolved. We know a lot nowadays about ACEs. We know a lot about the sorts of things that can happen to children that can either be identified and addressed, or can then lead to all of the kind of common mental health problems. So yeah, at the psychological level, there's that. But at the spiritual level, it's about enabling that child through the compassion of a therapeutic relationship to maintain connection, inshallah, through the counselor to a relationship with their Lord.
Barakallahu feekum. Thank you so much for the clarification and adding on, mashallah. Great reflections. So there's a lot of questions here. There's a lot of interesting reflections as well. I'm going to read one from Sister Maryam. I think it helps with children to use the advice of Ali ibn Abi Talib radiallahu anhu on parenting and break it down to 0 to 7-year-old play therapy, 7 to 14 spiritual cognitive behavior narrative therapy, and 14 to 21 guiding and mentorship and recognizing them as young adults. SubhanAllah, I love that. I've seen this before, this advice that Ali ibn Abi Talib is giving us. So beautiful, Sister Maryam. Thank you for the advice. Sister Sophia is writing, should the family as a whole get support as children are not just living in isolation? That's a question. Should the family as a whole get support as children are not just living in isolation? What do you say, Ustad Abdullah?
I think it really depends on what the underlying situation is. It's very, very easy to identify, to focus on the child. I was carrying out some supervision, literally yesterday. And it was in relation to a client who was referred to counselling by family members, parents, and it was in relation to their behaviour. And there was a kind of like doorknob confession in which the child identified a long-term problem within the family that was never mentioned by the parents. And the child kind of only mentioned at the very, very end of their session. But when that was taken into consideration, what was clear was that there's a kind of masking taking place amongst all of the adults, and there's a child who's experiencing at an emotional level this familial problem. And it's convenient within this particular family to identify that acting out that experience as problematic rather than a symptom of a problem which is actually located within other members of the family. And this is what I'm trying to suggest to you. It's like, it's not a simple case of should the family get support? Should it always be about the child? It has to be about what the truth of the situation is. Why is this child before any of us in terms of therapeutic work? Is this situation related to this child in isolation? I've been talking earlier on today about intrapersonal, interpersonal. I've been talking about our relationships within ourselves and our relationships with our core, our families, the people who we actually develop our sense of identity from. Now, if the difficulty is external to the individual, then there is a need to actually focus on the difficulty. Otherwise, you're only just playing catch up with the individual. And that doesn't matter if it's an adult or if it's a child. And I say if it's an adult or a child, acknowledging that one of the things that we find ourselves working with is family systemic systems of abuse on certain occasions. So yeah, it's very convenient sometimes in families to say the problem's there, when actually the problem may not be.
That's a good reflection. Thank you, Ustad Abdullah. Many reflections in the chat. MashaAllah, people really enjoyed your talk, Ustad Abdullah. I hope to collaborate with you more times in the future, inshallah. That will be an honor. Some people are reflecting upon their own education. So let me just say that you guys are doing great in studying. And may Allah grant you tawfiq. Sister Maryam is doing her clinical work, she said. She hopes to take this and develop a program for Muslim children. Inshallah, Sister Rawiya is writing, Bismillah, Ustad, how can you bring more ease to your patients by raising awareness of the Muslim community as to the dichotomy in our feelings and the way we act on daily basis?
Oh my, look, I'm only going to talk again in the context of the work that I am aware of in the United Kingdom. You're talking about a dichotomy. I'm aware of the fact that for many of the people that we're working with, there is the reality of their lived experience in the wider world and the reality of their lived experience within the Muslim environment, be that their home, be that their community. And one of the things that's just true of the United Kingdom at this time, and I'm saying that because I mentioned in the talk, you know, our first counsellors qualified just after 9/11. So I'm talking about therapeutic work which is taking place in an ongoing war on terror, in which we are the problem. So the context, the wider context, is in a way something which can create a schism, a dichotomy. Now, what that then means is we need to work with how each client actually weaves their truth through that dichotomy. There are some people who are very clear about the fact that they live by their deen irrespective of circumstance. And there are some people who will live in one context with a mask and in another context with another mask, or in one context with a mask and in another context without. Now, to suggest that everyone should be able to make that transition to simply being the true person they are of faith in all situations is not to recognize the distress and the difficulty that comes with that. It's like we have to accept that sometimes it's an evolutionary process, and that process has to be defined by the client. But it's an ethical problem, it's a moral problem, it's a difficulty, but then difficulties are what bring us to therapeutic work, aren't they?
Alhamdulillah. And difficulties bring us also closer to Allah subhanahu wa ta'ala if handled in a correct way, of course. That's the trials and tribulations and the notions of how we as Muslims deal with them. Ustad Abdullah, mashallah, there's so many gems, so many questions. People are writing, some people are writing to me. I can't follow all the questions that you guys write privately, dear brothers and sisters. Write them in the chat so everybody can see them. I try to also catch those who have written private, of course. I can't catch all of them. We have time for a last question. Sister Amina, okay, that's not a question. So she says, Salam from Malaysia, feeling blessed to be able to join this session. I'm a retired child and adolescent psychiatrist with a diploma in Islamic counseling. I fully agree that Islamic counseling is far superior than CBT as it is simply so holistic and dynamic. I agree we need so much more work in this area. Thank you, sister, for your service and for your studies, and hope you can join the ISIP. We love people that have been in the movement for many, many years. We have so much to learn from you, Sister Amina. If you can write your details to me privately, your WhatsApp number, email. We need more people in Malaysia, actually. Our Malaysian chapter needs you. So inshallah, Sister Amina, reach out to me and we will add you there. Just write your details privately. And then who else? Let's go down here. Jazakallah khairan, very insightful. Jazakallah khairan. All of you who want by the way, would you be okay, Ustad Abdullah, to share your slides with the participants if they want to have access to it? All right. So
if they can put up with the typos because I'm dyslexic, fine, no problem.
I'm sure they will. I love it. I love when Allah creates us diverse, Ustad Abdullah. All these all the modernity's way of pathologizing us is actually the problem of modernity, not the problem of the individual. To be dyslexic is actually a blessing in many ways. So yes, we will email us. So everybody, I shared a link for all of you who want access to the slides and all the articles and courses of Ustad Abdullah. Register yourself in that link and we will email out all these information to you, inshallah. All right, there is a last question here. Let's hear. Tasneem is writing. Okay, this is not a question, it's just more reflection. MashaAllah, the information shared has been most needed. We are all carrying childhood baggage which comes to sabotage us when we least expected. Connecting to Allah and trusting in Him is the key to unveiling the mask on ourselves. Yeah. All right, here is a question. This is also reflections. All right, many reflections here. All right, dear brothers and sisters, we love all of your reflections. I think we need to end here now to respect Ustad Abdullah's time. Thank you so much, Ustad Abdullah, for taking your time to be with us. We have benefited so much from your presentation and from giving us a small, teaser of all the, knowledge and experience that you have accumulative gained throughout your years as a clinician. May Allah subhanahu wa ta'ala grant you tawfiq in your work. Together with Sister Sabnoom, I'm looking forward to have a meeting with you to further discuss how we can collaborate more, inshallah. For all of you who answered questions and we couldn't address them, please forgive me for any shortcomings, dear sisters and brothers. We try to address your questions. You can always write them in the WhatsApp groups and we can try to answer them together, inshallah. One question that is always asked, and I just want to clarify, Islamic psychology as a field that historically was developed by scholars from different disciplines within Islamic thought. Scholars from the fiqh tradition, from the kalam tradition, from the tib tradition, from the tasawwuf tradition, from the akhlaq tradition, from mainly these traditions. They try to understand the science of the soul, the structure of the soul, the reality of the soul, the level of the soul, and how you can treat the soul and heal the soul. So it's a multidisciplinary field, Islamic psychology, developed by scholars from these traditions and also other traditions as well. All right. And the way that we approach it in modernity is also a rooted revival. So it's rooted in our tradition. And first and foremost, all scholars were rooted in Quran and Sunnah, the primary sources of Islam, right? And then they were also working on each other's work and, refuting some things that they didn't agree on, always having adab al-ikhtilaf, by the way, hence accumulative. They perfected each other's works until contemporary era. What we see today as Islamic psychology as a rooted revival done by many of our excellent scholars in this modern era. And the rooted revival is done from different aspects. It's a top-down approach that some people do adhere to, which is, in a sense, Islamization of psychology. There's a bottom-up approach that many scholars adhere to, which is an indigenous approach to Islamic psychology. So there are different ways of approaching Islamic psychology, but all the ways are united in Tawheed, in Quran and Sunnah, but there is a multiplex way of applying it, which is the beauty of Islam. Unity in Quran and Sunnah and Tawheed, multiplexity in approach. And what we try to do in ISIP is to show all approaches and our works are, rooted in Quran and Sunnah, but then within that there is different approaches. So now we listen to Ustad Abdullah's beautiful approach. We have showcased other scholars who have also beautiful approaches, and we try to showcase the buffet of different approaches within Islamic psychology, Islamic counseling, Islamic psychotherapy. Then it's up to you to decide as a practitioner, as a student, as a Muslim and Muslimah, which approach is closest to you, to the way you would like to work with your clients or the way that you would like to advocate for the field, and feel free to show that. That's the beauty of Islamic psychology. If you compare that with other psychological traditions, some of them are not as dynamic. not as multiplex, as my way or highway. That's not the way that we do. Our highway is Quran and Sunnah and the path towards Allah subhanahu wa ta'ala. That is the highway. The rest is how can you use? Some people use a bicycle in the highway. Some people use a car. Some people use a camel. So this is the beauty of multiplexity. Why I'm answering this question, Ustad Abdullah, is because there are some questions with regards to this, and we often hear these questions. So I just want to clarify. And in ISIPs, we don't take any stands. As long as it's according to Quran and Sunnah, we want to showcase the multiplexity. We want to showcase different scholars, their practices, their approach. One of them being our beloved Ustad Abdullah here. And there are different approaches. We see in the Arab world, there are many different approaches you can find in Egypt, in Morocco, in Saudi Arabia. You find in also in Indo-Pac region, different approaches in India, Pakistan, in Southeast Asia, Malaysia, Indonesia, and Europe, and UK, where Ustad Abdullah is, in US, and Canada, and Turkey, etc. So I just want to highlight that for you to know that. And this is the multiplex nature of Islamic psychology and Islamic thought generally. Unity comes in Quran and Sunnah. All right, brothers and sisters, we will meet each other again in the second Sunday of September. Then we will have a lecture again, and we will announce who that will be, inshallah. We have a very beautiful program during autumn and winter with many excellent scholars and practitioners. We will love to continue to collaborate with Ustad Abdullah, his colleagues, Sister Sabnum, and rest of his team. They're doing an amazing job. So we're always at your service, Ustad Abdullah. Thank you so much for joining us. And would you like to say last words, anything you would like to say before we end the session?
The only thing that I can think of to say is that I'm thankful for having had this opportunity to be with you all, to share with you what we do. And I ask that Allah accepts what we do, all of us here.
Ameen.
And that we may all meet again in paradise, inshallah.
Ameen, mashallah. Beautiful. Ameen, ya Rabbil Alameen. May Allah subhanahu wa ta'ala accept your amazing work, and as one of the pioneers in the field of Islamic counseling. And mashallah, UK has developed a lot of great counselors and psychologists like yourself, and we're very honored to be with you, inshallah. And whatever you need from our movement, we're always at your service. Please extend my greetings to your family, Ustad Abdullah. It's been an honor. And round of applause to our Ustad again, dear participants. I also want to thank all of our brothers and sisters today. Thank you so much for your engagement, for your amazing reflections, for your insightful questions. Please forgive me for any shortcomings in my way of hosting this. As I always say, I have a lot of shortcomings in my ways. Allah knows. And if anything good came from me, it's all from Allah. All the mistakes are solid in mine. I want to thank also Sister Aya and Sister Ruqaya for facilitating this international lecture today in such an excellent way. You're both doing an amazing job. Please go into the directory of all the organizations that are offering programs in Islamic psychology. Feel free to check out our website, check out how to be members, join our WhatsApp groups, and we will meet you guys soon, inshallah. I wish you all a great continuation of the day. Take care of yourself, dear brothers and sisters. An honor to be with all of you. You're all doing an amazing job. Assalamu alaikum wa rahmatullahi wa barakatuh.